So today we'll see the dosage adjustment for the uremic patients. So what is the dose we have to select for the patients who have uremia? Okay, so this dose adjustment should be done in accordance with your changes in the PK and PD parameters of the drug. So once if you give the dosage to the person, the clinician or the physician should continue the monitoring of your pharmacokinetics as well as your pharmacodynamics of the drug, and he should evaluate the patient's renal function. So first thing we have to know is about your loading dose. So loading dose is nothing but your first dose which we are giving to the patient. So at the starting dose, that is the first starting dose, is called as the loading dose. So that mainly depend upon the distribution of the drug. Once you administer to a patient, so how it will be getting distributed in your body and how it shows the apparent volume of distribution, etc., you have to consider. So loading dose is the same in uremic patients when compared to the normal renal function. So there is no change of any dose, that is your loading dose, in uremic patients as well as your normal functioning patients also. So in both the cases we are going to give only the same loading dose. Next, coming to the maintenance dose. So you know already what is meant by this maintenance dose. After giving the first dose, that is your loading dose, and how the clearance is there, that is how the drug is getting distributed into your body and how it is getting cleared in your body, so that indicates your maintenance dose. So this maintenance dose is based on the clearance of the drug in the patients, in the uremic patients. So what happens during this phase means, in the uremic patients the rate of renal excretion is lower, as well as your total body clearance is also lower, because as renal function is very low, automatically your clearance rate will also be very low. So most methods for this dose adjustments assume non-renal drug clearance to be unchanged. So compared to the renal drug clearance, so all other routes of drug excretion doesn't affect in the uremic patient, but only in the patients who have the uremia. So there will be renal functioning will be lowered. So this dosage regimen development is based upon the three parameters, that is decreasing the maintenance dose and increasing the dosage interval and changing both maintenance dose and dosing interval. By following these three methods, once we can calculate any dosage regimen to the uremic patients. Okay, so first thing is that we have to decrease the maintenance dose and we have to increase the dosing interval. So number of times we have to increase the doses, and we have to change both maintenance dose and dosage interval also. So although this total body clearance of a drug dosing is sufficient for dose adjustment, but the elimination half-life is also taken into consideration, because as your renal function is very low, it will take much time to get eliminated. That means if your renal function is very low, your T half will be increased. Okay, so finally this if you want to do any dosage adjustment in uremic patients, you have to prefer two parameters, that is your drug clearance from your body, that is your total body clearance, as well as your elimination half life. So these two parameters will be making an important role in deciding a dosage regimen in the uremic patients. So how we are going to do the dosage adjustment means, there are a number of methods are there. So basically we'll follow the three methods, that is the first one nomograms, we have already studied about this, and the second one is general clearance method, and third one is Wegener method. So coming to the nomograms, so there will be a sheet, so it will be indicating the height, weight, age of the patient. So based on that we are going to give some calculations. So these are the charts. So these are the charts which are available for use in estimating dosage regimens in uremic patients. So these nomograms will be based upon the three parameters. So what are the main parameters that is going to take into consideration means, the first one is the serum creatinine concentration and the patient data. So it plays a major role in the nomograms, that is height of the patient, weight, age and gender of the patient, and also the PK parameters of the drug. Most methods for dose adjustment in renal disease assume that non-renal elimination of a drug is not affected by the renal impairment. So I have already told you before that non-renal elimination of clearance will not be getting affected in the uremic patients when compared to the normal renal function. So the remaining renal excretion or rate constant in the uremic patient is proportional to the product of a constant and the creatinine clearance. That is nothing but the renal excretion. So what are the drugs that is getting eliminated through your kidneys is directly proportional, that is it is proportional to your creatinine clearance. That is the clearance of your total creatinine from your body, which is indicated by CLCR, that is nothing but your creatinine clearance. So finally there will be a equation which is mentioning the rate of elimination of drug in the uremic patients, that is given by Ku. Ku is nothing but uremic elimination rate constant. So what it will be means, that is equal to KNR, that is nothing but your normal elimination rate constant plus it is proportional to your creatinine clearance, that is CLCR. Okay, so from Ku by Kn ratio, the uremic dose can be calculated by the equation. So we are going to calculate the ratio. So you can take like this: uremic dose is equal to Ku by Kn into normal dose. That is nothing but your urine elimination rate constant as well as your normal elimination rate constant into your normal dose which you are giving. So finally, by using the nomograms, by following this equation, you can design a dosage regimen to the uremic patients. So this is the first thing, that is your nomograms. Next is general clearance method. So this method assumes that the creatinine clearance is a good indicator of renal function and that the renal clearance of a drug is given by CLR is directly proportional to your CLCR. That is nothing but your rate of elimination of your drug from the kidneys, that is your renal clearance is proportional to your creatinine clearance. So therefore the renal drug clearance CLUR in uremic patients is given by CLRU is equal to CLCRU by CLCRN. That is nothing but your ratio of creatinine concentration in the uremic patients to the creatinine concentration in the normal people into CLR, that is clearance, renal clearance. So that is when CLU is equal to CLNR plus CLR, CLCRU by CLCRN. If normal total body clearance is CL1 minus FE, then equation 2 reduces to, we have to substitute the CLU value here. So if you substitute the CLU value here, the equation will be becoming like this: CL into 1 minus FE plus FeCl into CLCRU by CLCRN. So this equation represents your general clearance method. So in this method you have to remember one point, that so the ratio, that is your the normal creatinine clearance is proportional to your creatinine clearance in the uremic patients. Okay, so that is the ratio which is indicating that CLCRU by CLCRN. Okay, so CLCRU is nothing but creatinine clearance in your uremic patients and CLCRN is nothing but the creatinine clearance in the normal patients. Okay, so that is your general clearance method. Next, Wagner method. So this method describes a linear relationship between creatinine concentration and first order elimination constant of the drug in patients. This method explains that elimination constant for a patient is obtained from the creatinine clearance. That is nothing but totally the elimination of a drug in the body is determined by the creatinine clearance function only. So that is given by the equation K percentage is equal to A plus B CLCR. That is nothing but A drug and B is another drug. So the creatinine clearance of the both drugs will indicate the it will indicate the dosage regimen calculation in a body. So you have to remember the 2 points, that totally if you want to design any dosage forms, you have to check the creatinine clearance in normal as well as in your uremic patients, and also you have to check the T half of the patient. So these three methods are totally based upon your creatinine clearance in your body only. So we are just calculating the ratios of creatinine clearance in normal to the healthy in the normal to your uremic patients. Okay, so these three methods will show or which will help in your calculating your dosage regimen in the uremic patients.